Lieutenant Governor Mary Taylor and her plan to scrap Obamacare in Ohio. Welcome to Columbus on the Record this week. We'll get to our panel discussion in a moment, but first we are joined by Lieutenant Governor Mary Taylor, one of 4 Republicans running for governor next year. Mary Taylor, welcome to Columbus on the Record.
Great to be with you.
This week we are talking about health care. Lieutenant Governor has been a sharp critic of Obamacare for years. Now she's presented her health care plan for Ohio. Her plan would eliminate Medicaid expansion almost immediately. She would create a direct primary care system where people would pay a monthly membership fee to cover primary care and preventive services. And the plan would create health savings accounts for people who work multiple part-time jobs that don't offer health insurance benefits. Mary Taylor, let's start with your premise that Obamacare has been a disaster for Ohio. Now I looked in the dictionary, and disaster is defined as something that causes great harm. How has Obamacare caused great harm for Ohioans?
So Obamacare really is not working in Ohio. Insurance premiums have gone up 119% when you look at what the Department of Insurance just put out 2 weeks ago for premium increases. 42 counties in Ohio will, if you go on the exchange to purchase health insurance next year in 2018, you'll get to choose from one insurance company. It's not working, and the discussion and the debate has all been around whether or not you have an insurance card, and has not focused enough on, do you have access to quality, affordable care? So what I'm proposing is a consumer-driven, market-based approach to give patients, Ohioans, access to quality, affordable care, and not the debate and the discussion around the insurance card.
But other things about, there are portions of Obamacare, I think most agree, that are not working. One is the number of insurers available to each county. They want more than one, certainly. Not enough young people are entering the market. But when you look at some of the other numbers, you know, 80% of the folks who are dealing with a premium increase get a subsidy from the government. So not everyone is paying that 119%, correct?
I don't know the numbers around the percentage who get assistance from the federal government, but it speaks directly to my other concern, which is Obamacare and the Medicaid expansion under it are unsustainable. We have a $20 trillion national debt. We can't continue to fund or provide assistance in these types of programs that are just blowing up the costs, but aren't really dealing with the real issue, which is access to quality care. Speaking
of access, 725,000 low-income Ohioans now have insurance. They were not eligible for Medicaid before the expansion. 200,000 folks have joined the exchange, whatever faults it has. The number of uninsured in Ohio has dropped by 61% since 2008. That doesn't sound like a disaster for those folks.
So my plan will bring down the cost of health insurance premiums.
But would you say that's a disaster for all those folks I just mentioned?
So my plan will bring down the cost of health insurance premiums, making it easier and more affordable for more Ohioans to have access to the type of insurance they want, and also give individuals direct access to their physicians without all of the burdens that come with insurance, dealing with an insurance company. Also, I believe that Medicaid should be restored to what it was originally intended. For those that truly are not able to work, that are disabled, and because of family circumstances, again, are not able to work. Today, able-bodied adults are covered under Medicaid. The goal would be to get those individuals back into the workforce, getting them back to work with a job that helps them achieve their God-given potential.
Many of those folks have jobs. They have 2 jobs. We'll talk about that in a moment.
Yeah.
But not all of those folks are. I think 65% have jobs, and Governor Kasich has said that within 18 months they are getting off of Medicaid, the expansion.
So ultimately my goal is to give people the opportunity to fulfill their God-given potential, and I refuse to accept the only way for these individuals to have access to affordable quality care is through Medicaid, which is why we're talking about the direct primary care model, where we can restore the important patient-doctor relationship, and also allowing those individuals that are working multiple part-time jobs, giving the opportunity for their employers to help them or provide some assistance for them to purchase affordable health insurance.
Let's get to that membership plan. It calls for that direct primary care plan. It's like a monthly membership fee. How much would that fee be?
The fee is really going to be based on, it's going to be based on the market. It's going to be based on
any ballpark figure, what it might be?
It's going to be based solely on the market and what a direct primary care doctor wants to, how they want to enter into an arrangement with their individual patients. It's also going to open up the opportunity for more more Ohioans have access to the important care for chronic illnesses, for example, again, going back, dealing directly with their doctor. And the price truly is going to be based on what the market demands.
Would this membership plan cover, say, contraceptives for women?
The plan will cover whatever the physician and the individual patient chooses for it to cover. And that's my point. My point is this is truly a consumer-driven model based on what the market demands. It's not based on what the federal government mandates you have. And so it could cover as many things as it wants.
The state's not going to require that the health insurance plans cover a list of essential conditions or illnesses that Obamacare requires.
So really, I'm going back to allowing consumers to pick and choose the type of health insurance policy that meets their needs and giving them access directly to their doctor without having to worry about whether or not your doctor's in network or out of network, and whether or not you have copays, deductibles, and extraordinarily high
We had all of
out-of-pocket
those
costs.
things before Obamacare. We've had networks for a long time.
But premiums have gone up 119%.
For the individual market.
For the individual and small group market. If you are a small employer today trying to provide health insurance to your employees, when I talk about premiums going up 119%, that's not just those purchasing on the exchange. That is for every single Ohioan who's purchasing health insurance today.
No,
costs
actually,
are unaffordable.
that's
that is
not
correct.
No, the health insurance premiums have gone up on average 5% since 2008. During the Bush administration, they were going up 9% per year.
Health
For
insurance
health insurance
premiums,
through their employer, which most of us have.
health insurance today, on average, has gone up 119% because of Obamacare.
For the folks in the individual market.
During the time that I was the director of the Ohio Department of Insurance, premiums had gone up on average 91% for small employers and for individuals purchasing on the exchange. With new rates coming out next year, they're going up an additional 34%.
Folks on the exchange.
For anybody purchasing health insurance in the state of Ohio, not just the exchange. I do not agree with the facts you are using or the premise of the statement that you're making. Health insurance is unaffordable for all Ohioans, including those that are getting their health insurance through small employers. I would really just ask you to go back and check your facts on that.
I know my insurance has not gone up 119% in the past 4 years.
Small employers have been shielded to a certain extent because they've been able to use grandfather plans that are only effective to the end of this year. They are going to get the full force of Obamacare on all the mandates under it that truly are driving up the cost of health insurance starting next year.
Let's get to the overall just economics of this. Is there a way that the private market can adequately insure low-income people and give them the resources they need to get good health care? Because they don't have a lot of money. They don't have money to buy health insurance like more affluent people do. The private market has never been able to do that. How is your plan going to encourage that?
Again, I disagree with your assertion the private market was not able to do that. We have this, I believe in personal liberty, and I believe that government should not mandate or force individuals to purchase any product they do not want to purchase. Individuals pick and choose the type of coverage they want based on their needs and based on what they can afford.
They get sick and they go to the ER and that costs hospitals.
But because we have a federal mandate today that says everybody has to purchase health insurance or be subject to a penalty, the federal government is forcing individual consumers to purchase products they don't need, all the while driving up costs by 119%. So prior to Obamacare, we had over 60 health insurance companies selling health insurance. Today, we have less than 10. And it allowed consumers, again, to define the type of health insurance product they wanted, and they were able to purchase that in the market. Today, you can't do that. So what I propose is truly addressing the issue. Not do I have a health insurance card that I can't afford to use, but really looking at how do we get consumers more directly connected with their doctors.
Will the same number of folks who have health insurance today have this health insurance under your plan? The same total number.
The bottom line is that if you have health insurance today, you will have a more affordable, quality product available to you under my proposal.
Will the same number of folks have health insurance?
The same number will have the option to purchase health insurance.
Access, not
It's about access and affordability. It's not about a government mandate that you must purchase a product that you may not want or may not be able to afford.
We'll leave it there. Thanks
Thank
very
you.
much, Lieutenant Governor Mary Taylor. We'll get to our panel discussion next on Columbus on the Record. Joining us on Columbus on the Record this week, Laura Bischoff, State House reporter for the Dayton Daily News, Jim Siegel, State House reporter for the Columbus Dispatch, Joseph Moss of the Ohio Hispanic Coalition, and Marianne Sharkey, public affairs consultant. Well, there you have it. John Kasich's chosen successor wants to throw out what has become his signature policy in his 2 terms as governor. Republican state lawmakers are also considering freezing Medicaid expansion. To do that, they need to override Kasich's veto of the measure that was in the state budget. And of course, in Washington, Rob Portman is leaning towards voting for the latest repeal of Obamacare. He voted for the last one before 3 GOP senators killed it. Jim Siegel, Mary Taylor has been very consistent in her time in office. She does not like Obamacare, and this is the plan to do away with it. Does this help her or hurt her politically?
Her
stance
on
Obamacare?
this? I don't know. It's hard to say in a GOP primary, considering the field she's in. I don't because I think only Jim Renacci, another GOP candidate for governor, has come out specifically and said he wants to do away with the expansion. I don't know that Husted or DeWine have come out with official position yet. If they have, I'm sorry, I just don't know them.
Yeah, it's softer at the very least, anyway.
Yeah. And so, yeah, look, I mean, you're talking again about over 700,000 people on the expansion, and if you put an end to that, it's going to be a tough sell unless you can figure out a way to get them coverage. Now, she's talking about this direct care payments, which could have some merit. I know this is kind of a building thing nationally, idea that we kind of cut out the insurance companies and do direct care and direct payments and pay monthly fees. I just don't know how you explain how people under 138% of poverty can afford $100 a month in direct care fees, and that is before you've actually been prescribed anything.
I'm kind of wondering, is this a topic that still resonates among the Republican electorate? Because this is really just basically an anti-Obamacare stance. Now, I do commend her for coming up with an alternative plan, and it's a plan that actually has worked in some countries, at least in the past, of having a direct primary care system, perhaps private, perhaps she didn't mention it, but I guess you can fill in the blanks that it might be with governmental assistance of some sort. So that is a great thing. But is this a topic that all of the gubernatorial candidates need to necessarily address in the
clearly John Kasich's done pretty well on this issue. I mean, he's maintained his popularity in the state of Ohio. No, I don't really think so. I mean, Obamacare itself, because it has Obama's name on it, is, that's a little bit of red meat in terms of the Republicans are concerned. But let's face it, the working poor are the ones who are taking advantage of this, and that the working poor are the ones that they're trying to reach out to in these Republican primaries.
I think that a lot of conservative Republicans still oppose Obamacare and expansion, and they're mad at John Kasich for defending it so vociferously. But I also think that there's a slice of Republican voters who are benefiting from Obamacare expansion. I mean, the 725,000 people under expansion, it's not like they were, check your partisan card and, we're only signing up independents and Democrats.
Yeah.
And her plan's so vague. I mean, I mean, you've tried to pin her down quite a bit in terms of what would the premiums be like, what would this cover,
How many would be covered? Yeah.
how it would be covered, and frankly, I didn't hear any real answers.
And the cost issue is real. This idea that Medicaid costs are growing and it's really expanding, especially federally, the state too, but to a much lesser degree because of the match. But at some point, you also have to ask why. Why are there 725,000 people on Medicaid expansion? It's because we have a poverty problem in this state. We have an income problem in this state, and that is really what needs to. You start addressing that more, and then the Medicaid problem becomes much less.
Do you see, she's calling basically John Kasich's what has become his signature program a disaster.
Right.
Well, how do they campaign together?
Well, even when you started out saying that she's his chosen successor, well, in terms of her being lieutenant governor, that's correct. But whether or not he really is going to support
He said
her,
he's in
But
support.
He said he's
Well,
going to back her, but I wonder.
but a
if
lot
they're
of
gonna-
his people are not.
Yeah.
A lot of his folks are not going to be supporting her.
As soon as she comes out against Jobs Ohio, I guess we'll just wipe the slate clean for.
Well, look, I think the 800-pound gorilla in the room, the discussion that nobody is having, is the one that Bernie Sanders kind of alludes to, and that is when you talk about trying to control costs in these things, you've got to look at the provider. You've got to look not necessarily the insurance companies, but why is it that it costs so much to get an operation in the United States or to get medical care? Other countries don't have it that high.
None of these plans get it to cost. I did check my facts. According to the National Conference of State Legislatures and the Kaiser Family Foundation, employer-based health insurance has increased 22% overall for the past 5 years. That's for all employers, though Mary Taylor was kind of pointing at smaller employers who no doubt do pay more because they have a smaller pool of employees to cover. Next topic. In November, Ohio voters will decide whether to strengthen a constitutional amendment giving more rights to crime victims. Issue 1 would require victims be notified when their offender is released from custody and allow them to sit in and be heard at all court proceedings. It's called Marsy's Law, named for a California woman who was stalked and murdered by an ex-boyfriend. This week, supporters started running a new TV ad.
You tried to move on. You tried to put your life back together. Until one day, you see him at the store, on the street, on your doorstep. The criminal who tore your life apart is walking free. But you might never know until you come face to face with him.
Critics argue the law will slow down the criminal justice process and cost taxpayers. Joe Mas, you're a defense attorney. What rights do victims have in this process, and will this amendment
You
help
know,
them?
my victims have had rights in the state of Ohio. Well, they've always had rights, but they have had specific enumerated rights since 1988. Since 1998, there has been something which became known as Roberta's Law that in fact included what has been mentioned in the ad, that is the notification and so on. But you mentioned one of the more important elements that I think that if I am a defense attorney and I'm concerned about it, but as a prosecutor, I would be really concerned about it, and that is that Marsy's Law, and as you know, the generic term, and as we have it as issue 1 here in Ohio, would allow the victim to actively participate in the court proceedings and hypothetically, according to Tim Young, the state public defender, possibly have to be afforded or given a state-appointed attorney in order to represent the victim. And that victim can then participate in decisions such as whether the case can be continued in order to allow the defense or the prosecution to prepare more adequately.
I mean, obviously, you want victims to be a part of this process. They're the ones who lost the most in, say, a murder case or something like that. But it's not the victim versus the defendant. It's the state of Ohio versus
Correct.
the defendant. And
Correct.
that's where the conflict comes
Right. I mean, I was a victim of a burglary, and I was given a number, and I was able to check online, and I followed all 3 defendants all the way to the jailhouse, and one of them was a juvenile. And I thought the system worked very nicely that way. It was nice to be able to just follow the case that way.
But you didn't have someone calling you every time they were in court.
No, and I frankly don't think I would have wanted that. As long as I knew what was happening to the defendants, I felt perfectly comfortable.
And in our county, we actually have specialists, victims advocates at the prosecutor's office that help the victim
Right.
and being able to communicate with
I
the
mean, I
prosecutor.
think rape is a different situation, clearly,
It's
or a
just that
homicide.
that's right. Not
You
all
know,
crimes are the same.
Right, right.
Where is this coming from, Laura? Is there just a
Well, this
folks
is an
want to
issue-
do good for victims?
Well, this is an issue
that?
that's been brought up in some other states and has passed. I think in California, and I don't have the list off the top of my head, but this is something that this guy Henry Nichols, Marcy's brother, has brought forward and has largely bankrolled the issue in states. And I think that it on its surface really plays well with voters who think, well, yeah, victims should have more rights, but then the devil's always in the details, and so it's really up to the voters to get informed on it.
This is another situation where you wonder whether it's really worth adding to the Constitution.
You know, good
Whether
point,
it should be
yeah.
a statutory, a provision on this, but maybe not in the Constitution.
I think it's a solution in search of a problem. And by the way, we have 9 out of 88 prosecutors that are endorsing this, including Ron O'Brien in our own county. But I guess supposedly 78, 79 then are not in favor of it.
Because Jim, victims would have a right to veto a plea bargain in theory,
Yeah.
which would be.
In theory, I'm not sure at the end of the day they could actually veto it, but they can certainly express an
But can you
opposition
imagine-
to it.
we
to a plea
have-
bargain. I mean, and I get the arguments. I
Yeah.
certainly do, because look, these are legal professionals arguing in an arena that average victims do not understand. Especially if you are heightened with emotional attachments to whatever has gone on, if it's happened to you or a family member, you're not going to necessarily be thinking about things in terms of what's the best legal strategy. You're going to be out for, potentially out for the most, skin you can get.
Yeah.
And so I understand they not necessarily wanting that included into the process. It could be problematic. I personally have not heard too many issues about victims' rights around the state. I haven't heard it come up much, but it doesn't mean it hasn't. But I think the general fear that if somebody's going to get out of prison, you not know about it, and you're going to see them on the sidewalk. Those kind of things resonate with people.
Yeah.
We have that already, though.
Yeah.
Yeah.
All right, let's get to our last topic. The investigation into the fatal accident at the Ohio State Fair this summer has taken a startling turn. Until recently, it was thought that inspectors were not really able to see the rust and the crack on the part of the ride that broke. But as the Dayton Daily News and then the Columbus Dispatch reported, it appears that crack was visible. Here's a picture of the ride taken just before the accident by someone at the fair. If you look at the arm that broke, the part that broke off, you can see a line that appears to be the crack that developed. It's at the exact spot where the arm broke during the ride, killing one man and seriously injuring several others. That raises questions about the inspections, and then the State Highway Patrol chose that one picture to withhold from the investigative report issued to the general public. Laura Bischoff, you have been covering this. You've read the report. How does this change that narrative that I described?
Well, Franklin County Prosecutor Ron O'Brien did look at the picture, looked at the scene. I'm sure he read the whole report. There were more than 700 other photos that were released by the Highway Patrol. This one was retained. Initially, I think the story was that there was a copyright issue, that it was taken by a private citizen. That didn't really go over well with the press corps at all, because it was kind of like, we're looking through all these photos, where's the one with the crack? And I think, O'Brien decided there was not enough evidence for a criminal case, for criminal intent. I'm sure Joe could speak more to that, but I think the civil case is a whole other story.
Yeah.
The report showed that as soon as the ride operators were being interviewed, shortly into that process, the company had attorneys on scene to monitor everything, and I think they're fully expecting a lot of lawsuits.
What does this say about the inspections?
Well, I mean, when you look at it, and I know Laura's done a great job of reporting, and so have a lot of other people. We have only like 22 inspectors, and they've more than doubled the rides in Ohio in the last 2 decades. We have the same amount of inspectors doing what was 2,000, I guess. Is that correct, Laura? They're now up to over 4,000.
Right, I think it's gone up significantly.
I mean, that's very concerning, and I think the public clearly feels that these rides have been inspected, and they've been inspected, and they don't realize that the nationals are, the feds aren't even really involved in this.
Criminal negligence is what the prosecutors decided was not appropriate.
I think that would be very difficult to prove, and I think that probably requires a specific intent that probably wasn't even here. Now, before I get too deeper into this hole, however, I did look at the picture several times, and I noticed something on the left-hand side of the crack that appears to be a weld. And it's my understanding that, I think it was Laura's article that mentioned that there was a paint can of the same color as the metal that was found at the scene. And if it was re-welded in order to prevent the crack from becoming larger and then painted, then I think that there might be a problem, Mike.
Criminally or just civil?
I think possibly criminal. No, civilly,
Well,
the only question there is whether it's the operator or the manufacturer, and we were talking about that.
In the Highway Patrol's report, it indicated that the paint was red and the ride was orange. And so it was kind of questionable whether or not that had anything to do with it.
Oh, okay.
Let's get to our weekly off-the-record parting shots. Marianne Sharkey, you're up first.
Well, it's the Fall Classic coming up, so I obviously will
Browns
go again.
Bengals?
Browns Bengals, yes. No, I got to go with the Cleveland Indians winning it all the way.
All right.
They've had a heck of a season. It's just been a great run and a lot of fun.
All right, Joe.
Mike, I want to congratulate my one-time employer, Otterbein University, for starting a project whereby university leaders and students are encouraged to incorporate acts of kindness into their everyday lives. This is a offshoot from a Columbus Foundation project that is Columbus Kindness Month, and pat on the back to both of them.
Jim.
As Congress seems to be stumbling again on repealing Obamacare, the idea of implementing a freeze on the Medicaid expansion population in Ohio is again being discussed as a potential veto override in the House. They would need 60 votes. They have 66 Republican seats. The leadership is again trying to get folks to get on board with this. I talked to 5 House Republicans last week. Not a single one of them said, yes, I want to do this. Now, they didn't all say no. Some did, some didn't. But this clearly is not an issue that 60 House Republicans, I think, really want to vote on.
And more.
The Dayton Daily News, we did a package of stories on child marriage and found that more than 4,000 kids under the age of 18 have been married over the last several years, including 59 15-year-old girls. That series has sparked introduction of one bill and possibly another one coming. My prediction is it's not going to be a slam dunk. It has not been an easy lift in other states, so stay tuned.
My off-the-record comment is I'm on a debate sponsored. We're partnering with Channel 4 on an issue 1 debate. That's the drug prices question. I need your questions. We're taking viewer questions. So go to WOSU.org, click on contact, and suggest some questions. That's Columbus on the Record for this week. For our crew and for our panel, I'm Mike Thompson. Have a good week.